I'm Malini Rajagopalan from 1Cell.ai. I first want to say thank you so much for taking the time to come and speak for a few minutes with us and also attending the Paul's 2025 conference, the first one, first of its kind, by 1Cell.ai. So what I'd like to do first is just get a little bit about, your affiliation, if you could share your full name and your affiliation, but more importantly, how was your journey? How did you get into doing medicine and how that journey was?
Thank you, Malini. It's my pleasure to be here. So, I'm a clinical oncologist currently working in Khandare Cancer Center. So, I started my journey in medical school in 2001. So, that was our first introduction to medicine. So, it was a regular one. I cracked the exam, so I went into it. So, then the journey to oncology was a little interesting. I went to PGI Chandigarh for my postgraduate. Then I returned back to my country, Nepal. And I've been working in my country for last 14 years. So,
that was your medical. So, in all the years that you have been practicing, is there any one case of a patient that comes to mind where you treated the patient with the classical way of diagnosis and then classical treatment? Is there any patient that comes to mind?
actually, there are many.
Of course.
Actually, there are many. So that during our practice, we come across different patients, and each individual is different. So, though we mostly practice guideline based, but I should say that each individual is unique, and we approach them in their very unique way. So, yes, we treated a lot of patients with classical way, but I think the oncology field is one of the field where it's changing daily. So things are getting changing rapidly, and we have to get up to date with it. And things are getting better, actually.
So, along those lines, it's a segue into my next question. What do you think about the new technologies that are coming up at OneCell or any other companies? And how do you think that will change how you treat your patients compared to what you used to do before? How will it help?
We always used to say this in era of precision medicine. So we have to say each cancer is different because they have its molecular signature. Earlier, it was clumped together. So some patient actually get benefit and some patient didn't benefit at all. But we have no any means to differentiate them. But in this era of precision medicine, now we can differentiate those individuals. And I would like to thank all those who are working on molecular oncology, and especially ones who have been supporting us and helping us to identify those individuals.
Wonderful. So what is your vision for the future in oncology?
So, as I say, it's changing rapidly. So I think it's going in the right direction. We are now more and more targets, and we are getting better and better results. So probably in fewer times, cancer won't be a deadly disease that is considered. It will be more of a chronic disease.
So thank you so much for your time, and we appreciate your coming to give us a few minutes and also come and attend polls, and we look forward to working with you.
Thank you.
Thank you.